Okay, we actually have received some good news yesterday, and we're hoping that this will be one of the last days that everybody needs to come to the Capitol. And after a long fight that's lasted over 6 years, it feels like this could finally be the turning point, and we might actually be able to expand Medicaid in the state of Virginia. Today could be
Medicaid!
Today actually has the potential to be a very positive day, and I think the number one thing we have to point out is this decision to expand Medicaid to the state of Virginia. It makes sense. It makes sense for the people of Virginia. It's the fiscally responsible thing to do, and it's the moral thing to do. Every week, 11 people die while in the coverage gap, and that's not acceptable. We can't live in one of the wealthiest states in the country where people are dying because they don't have access to preventative care and decent health care. This move will be good for veterans who are often undercovered or fall in the coverage gap. This move is good for Virginia's economy. We can expand raises for teachers, and we have a lot more money coming into the state now, money that was ours that we'll get back from the federal government that we can spend on things we need in the state. So today, although we are here and still fighting to make sure that the Senate does the right thing, we have the potential to be a very positive day, and a lot of that is due to the people sitting right here, standing at the Capitol, the folks at home who are calling their senators and writing in. The people who are affected most by this have joined us in this fight. They're here, they've shared their stories, they've fought for their rights, and they've fought for the coverage that they deserve. So we want to thank everybody for standing with us and staying present and staying active in this fight and not giving up hope. We might see actual real change today, and that's due to the activists here, and we're really grateful to you all, and we're excited for the potential, the possibility. Today, we're still going to hear from some folks in the coverage gap. We're still going to talk to activists who have had the fight and why this is so important and why expanding Medicaid is the only option for Virginia. So with that, I want to hand over the mic to Christine Gregory.
Here I am.
Okay, I apologize. I'm so
That's
sorry.
okay.
I was looking the wrong way, but
That's
thank you for
okay.
being here.
No worries. Hi, I'm Christine Gregory Payne. Gregory's my maiden name.
Yeah.
And I am a member of the Virginia Nurses Association. I share my organization's belief that access to safe, affordable health care must be provided to all Virginians. And expanding Medicaid is the best way forward for our patients.
Woo!
We know that the vast majority of Virginians support Medicaid expansion, as do over 110 state agencies and organizations, including the Virginia Hospital and Healthcare Association, Bon Secours Health System, the Virginia Nurses Association, and the National Alliance for Mental Health. We are one of the 10 worst states in per capita Medicaid expansion, and hanging in the balance is the health and well-being of 400,000 people who are currently between the gap between our programs that we have now for Medicaid and the healthcare marketplace. In each month that passes, we lose on average $140 million. Federal dollars that could be going to improving the health outcomes of our low-income wage earners, our home health aides, our certified nursing assistants, our housekeeping department, those people whose services are vital to our overall economy. With more federal dollars, our hospitals and our clinics will benefit from reductions in the cost of uncompensated care. An increased enrollment could mean upwards of 15,000 new, good-paying, and permanent healthcare jobs. When Virginia's workforce is healthy, it is productive, and we all benefit. Continuing to deny basic coverage to those among us who struggle most to make ends meet, we're just propagating the cycle of health, of mental and physical illness, disease, and poverty. Our state senators and our state Senate Finance Committee, they've heard all this before. They've heard it from their constituents. They've heard it from countless advocates, and they've heard it from both the past and present Secretary of Finance. It's time for them to act. The time is now because time is running out. A budget that includes Medicaid expansion is fiscally responsible, and it is simply the best thing to do going forward for our Commonwealth. Thank you.
signed by Reverend Rodney Hunter. Thank you.
Shall we pray? To you, Lord, we give thanks for this great day. We are thanking you for touching persons' lives to come forth, to make this expression of what's going on in our Commonwealth. We ask your blessings upon so many families that have been hurt, bruised, wounded, and economically broken because of health care. We've come today from all walks of life, all walks of faith, organizations and communities to say, bless, O Lord, our House, bless the Senate. We pray that they do that which is justice and right, that every citizen of this Commonwealth should have the essentials of health. So bless us in all that we do. Bless us, O Lord, as we come together so that the House and the Senate can hear and see what's essential to make this Commonwealth the best that it can be. And we want to thank you for the organizers and those who continue to sacrifice their lives to make sure that all Americans and all Virginians have the health care that's needed. So we give thanks to you for giving us this vision and giving us hope, and we thank you for what has been done. To you we give all glory for calling us to this great cause. To God be the glory, great things he has done, that all of God's people say, amen, amen and amen.
Thank you very much. A lot of the background information, a beautiful prayer for today, and now we want to actually hear a Medicaid story. Sarah Seller is joining us today. Hey, Sarah. Hey.
There's not a whole lot of times that being really loud comes in handy, but I feel this is one of them.
Definitely one of them.
So I'm here to share my story because I am a recent law school graduate. I just graduated from Michigan State University College of Law in December. And I took the February bar, which I have passed, and I'm waiting for the clearances. I am 28 years old, so 2 years ago I was kicked off of my parents' insurance, and while I was in law school, I was on Medicaid in the state of Michigan. And it was the only health care that I had before on my own. It was always health care that I had been used. I've always been on my parents' health care. I've been in post-high school education longer than most people in this country are in high school. I am trying to become a contributing member to society to help those who need the help. And I will hopefully have a job very soon. Woo! Thank you. Without the Medicaid expansion in Virginia, I tried to buy health insurance because I am working, underemployed, and when I put in my information, put in my income for the last year, $10,000, put in my health history, no medical injuries in my past, no major illnesses. The only thing that I have in my past is I broke my nose playing lacrosse. Healthy 28-year-old, and it would cost me $15,000 out of pocket to be insured in the state of Virginia. If I had $15,000 laying around to pay for health insurance, I wouldn't be looking for a job right now. I'm not sitting around trying to be lazy. I'm not sitting around trying to, not have health insurance. I'm trying to have health insurance so that every bump and every bruise doesn't send me into a fear that, what if my friends don't want to pay for my GoFundMe? I don't think that Virginians should have to rely upon GoFundMe for basic health care. I don't think that young people should have to take a job that underpays them because of its benefits. I don't think that I should be financially burdened with health care I can't afford just so I don't die. I am healthy, but many people are not as lucky to have the health history that I have. Many people my age, especially in law school, have had medical problems in the past. Their health insurance would cost more. And because I live in Northern Virginia, because of the lack of funding for Planned Parenthood, the only health care I receive, I have to drive to Maryland for. And I have to rely upon the kindness of the Planned Parenthood workers in Suitland, Maryland, for not being like, this is a Virginia license, what are you doing here? The only health care I have is through an organization that is constantly on the chopping block. This is a problem. I need to be focused on my health. I need to be able to go to the doctor when I get basic things like strep throat or the flu or a UTI. Common things that are preventable that if I don't treat, I could die from. And we shouldn't have young people dying from things that can be treated with antibiotics. That's basically my story. Thank you.
I think the message is very, very clear today. Preventative care is the right choice. It's human decency, and it's the economic thing to do. Because when we lose young people out of the workforce, it just hurts Virginia in the long run. Thank you so much for sharing that story. Next speaker, Ms. Eunice, would you please join us? Sorry about that.
She might need some help.
Year-old mother, grandmother, and great-grandmother. I grew up in Spotsylvania County, and I was told to, graduate school, get a good job, go to, a good college, get a good job, and then I could retire and live in the lap of luxury. Nowhere in there did they tell me that something could happen just like that to change that. And so I went to Rutgers, which is a good school, got a good education, worked for 10 years before coming back home. And I came back to Virginia because that was, to me, the country of love. Virginia's for lovers. And so I wanted to let my children know the Virginia that I love. And I loved it when I would ride through or go or walk through, and somebody would speak and I'd wave to them and my kids would say, well, do you know them? I'm like, no, that's all right. That's what Virginians do. And so I eventually got a job. And since I was 16 years old, I had suffered from headaches. And these headaches was because I got hit, my head got hit on a cement banister when someone was trying to take my cousin, and I was wrestling. They turned around and they beat me very badly. And so, but I paid it no mind. I did my work. I paid my dues. And so I got a good job here in Fredericksburg, and I worked. But these headaches still remain. I went to the doctor. They told me they were migraines. They treated me for migraines. And so I went on and I worked some more. And then the headaches got really, really bad until I actually had to quit my job because there were days that I just couldn't pick my head up. And I worked at a 24-hour, I was on call 24/7. And so in the interim, I went to the doctor and I was diagnosed with a massive tumor resting on my optic nerve. And so the medicine was over $3,000 a month. So I had to make a decision. Am I going to take care of my family or am I going to get this medication? So I took care of my family and I worked. And so then I started getting these really, really bad headaches. I could not afford medical insurance. And so I tried everything I knew. So I made too much money for Medicaid. And then this Medicaid expansion thing came up and I was hopeful. I'm like, wow, okay, maybe I can do this. But I made too much money for it. So I just, I was at a loss. And so I worked. So then the job that I had to go to didn't have any kind of medical coverage. So what I started doing was to use the ER as my primary care physician. And so many of the people I know, this is what they do. And so in 2010, I had this really, really bad headache. I came home from an event where I had just kind of slid down onto the floor. And I found out that I had a tumor. And so I went to the doctor. They gave me some medication. They sent me home. So I went back to the doctor, and I was sent home again. So then that Sunday when I got out of the hospital, I went to church, and I said, okay, Lord, if this is my time, I'm ready, because I didn't know what was going on. But God said, no, it's not your time. I've got work for you. After that, I got involved with an organization called Virginia Organizing, where we talk about Medicaid expansion. And I'm like, okay, this is me. This is my story. When I went to the hospital, Sunday, Monday, Tuesday, Wednesday, Thursday. And I just refused to go home. Now, I still don't have any kind of medical coverage. And so then they had to rush me to Charlottesville. The massive tumor I had resting on my optic nerve and burst. So I woke up the next morning and I'm blind. And so I still didn't have medical insurance, you know. And so I'm like, okay. And so I've been working for Medicaid expansion for a long time. I kind of cut my story short because my story is not as important as it is as to getting health care insurance. So now I have Social Security. You know, they pay 80%, 20%. I just recently had an operation. Tell me, what is 20% of $30,000? We need Medicaid expansion. I know those 400,000 people, I know at least 50 of them. I'm one of them. I don't know when my sight may go out. And so it is just, it's a human right, it's a civil right, it is just right. And so, you know, I tell people, I very much believe in God, and I believe that, you know, I tell the doctors and things that they're a greater doctor. And so I remember when I woke up that next morning, and they kind of were shaking their head, you know, and because I had been blind, and he said, oh yeah, she's never going to be able to open my eyes. I actually didn't know my eyes was closed. And so my eye popped open, and he said, oh, you can open your eye? Yes, sir. Because I was determined that this was not going to be the end of my story. When he came in the next morning, I said, hi, Dr. Jane. He said, oh, you heard me coming? I was like, no, sir. I can see you. He said, you can see me? I was like, yes, sir. And he said, you can't see me. What time is it? So I told him what time it was and all the writing up under the clock. And so, but that was I still had a struggle because what happened was I had cataracts. I still don't have health insurance. And it took me exactly 1 year to get the cataracts removed because that's how long it took me to get medical insurance. You know, I paid my dues. I did what they told me to do. I got a good job. You know, I took care of my family. I came home to give back to my community. I need us to have Virginia for lovers again. To be honest, I'm just not feeling very loved again.
We are very grateful to the folks sharing their story today. Thank you so much for being here today with us, Ms. Eunice. We touched on a really important point. We're told that if you work hard, if you put in the time, you get a good job, you go to school, that you can get ahead in this country and in the state of Virginia. And it's not fair. We can't leave people like Ms. Eunice behind. She did all the right things, just as she said. We have an obligation to take care of people in our community and not leave them high and dry. Thank you again for sharing your story. Now, I just want to draw attention. We've done a die-in in multiple weeks. Many of the people have been here. We've live streamed on a lot of the same accounts, so hopefully folks have already seen these actions. The die-in is a symbol of the people who are dying every week in the coverage gap just in the state of Virginia alone. It's a very symbolic act. It's a very jarring image. And we still came out here today for this visualization, and Marilyn is going to come join us and share with us what this visualization means and what the implications of today's action could have on this message and this kind of demonstration.
Okay, thank you.
Thank you.
It's hard to get up once you're dead. So Senator Normanton, Black, and Vogel, and all of you Republican senators, my name is Marilyn Karp, and I am a street fighter from the Bronx. I moved here from New York 15 years ago. Since February 19th, this is the 4th People's Caravan for Medicaid expansion that we have organized here in Virginia. We really come from all over. Okay? This is our second die-in. But you know what? It's possible to talk about the positive things that will happen when we expand Medicaid. So all of you dead people, stand up. Turn our sign upside expansion is associated with increases in cancer diagnosis. More people will live. Medicaid expansion significantly reduces the mortality rate for children and infants. Where are my beautiful children? These are the people who will live when we expand Medicaid. Medicaid expansion means more people will live. It gives people security and allows them to get treatment for their ailments. It will reduce the sum total of human suffering in Virginia. You ought to do it even if it costs money. But if you can't accomplish that moral good while actually saving money, you'd have to be crazy not to do it.
Yes.
Woo! Woo! It would be nice, Senator Norman, if you would admit your reluctance to expand Medicaid has nothing to do with the alleged practical costs. It's because you have made a moral judgment about government and poor Americans. All of us standing here today, all of us who have called and emailed and texted and tweeted, and the 83% of Virginians and more than half of the people in your districts that you can see from the signs we have over here want you to expand Medicaid. So what do we want? Medicaid expansion! When do we want it? Now! Thank you.
All right, this is definitely the outcome we want to see out of today. More preventive care, more resources for folks. Thank you, Marilyn. And again, a huge victory today is from so many of the activists who have spent years in Virginia fighting for this expansion. It makes fiscal sense and it'll save the state money, and it's the right thing to do. Now we'd like to welcome Senator McPike, actually, who's here today. Thank you, Senator.
Thank you. Thank you all for being here today. As Gina said, this has been years in the making.
Yep.
And for the right reasons. You know, one of the fundamental things that you've heard and debated revolves around the fiscal construct. But, you know, our responsibility for a fiscally responsible framework does not negate our obligation as moral human beings to one another.
Amen.
That's why everyone has joined us here today. That's why you've been along this fight for years. Yeah. And that's why I'll be proud to cast my vote for Medicaid expansion. But let's not forget, hopefully over the next few days, we'll make the votes. We've got the votes to make it happen. But let's also not forget that beyond the 400,000, there's over 750,000 Virginians that don't have access to health care. So this is a step that we have a responsible fiscal construct to move forward with that can help real lives that you've heard today. Folks who have worked hard in their lives and have had medical troubles, have been left themselves out of work and without coverage. I think we know in our hearts, and true to ourselves, that it is the right thing to do. It is the right moral obligation. We can stand proud and tall and smile together as we've marched, we've fought over the last few years to make sure that we expand access to health care for all in Virginia. So thank you guys for being here today. We've got more work to do. So thank you.
Yeah, thank you so much, Senator. Thank you for being here.
Thank you.
Yeah, and a true serviceman. Last time the senator spoke a lot about his experience as a firefighter, even with this cause, and the people that it will help, the money that it will save, and all the potential of the good it has to do for Virginia. Thank you for all your service. Yeah, thank you. Excellent. So we want to move on to a few more testimonies and then a preview of what's going to happen. We will greet the senators down on Bank Street, but just two more speakers before we close out. Some of our SEIU partners. If we can start with Charles Carter. That way. Sorry, Charles. Hey, how are you today? I keep looking the wrong way. I should just go the
Carter, I'm a board member for home health care for SEIU Virginia 512. I'm also a two-tour Vietnam veteran. If it was not for that, I would not be able to afford my medicines. In the state of Virginia, there is 22,000 home health care workers that is through the Director Assistance Program. They have over 40,000 Virginian home health care workers being paid through PPL that cannot afford health care. They're going into these homes of these people with this big money, of these senators that are sitting up here on this hill, and taking care of their loved ones. But they can't even afford health care for their own families. They cannot, a lot of them have to ride 2 and 3 buses to do 2 and 3 jobs a day just to be able to get 40 hours to feed their families. Where's the money coming for health care? We need Medicaid expansion in the state of Virginia. I'm not out here doing this for myself. I'm doing this for everybody that needs something. The lady with the children, because one day they're going to need it. These young people that's going to college, that's right now have insurance to their families, because at the age of 25, it's gone. How are they going to take care of their health? They're going to school to get an education, they still have to pay back all these loans. Where is the money coming from? The Senate has to understand that this is not about them. It's about the people of the state of Virginia that have put them in office to do a job. Woo! We have to get them to understand that, okay, do your job, or the next election you're going to be looking for a job, because we're going to find a way of getting you out of office.
And you'll want health care.
We have to fight. I've been fighting since I was 8 years old. I'm not going to stop now. After this day is over, and even when they vote yes on this, we still have to continue fighting to get what the people of Virginia need for our health care, for the education of our children, for the needs of our elderly. We have to continually fight. I know, because I'm one of the elderly. I'm 66 years old. I paid my due to society. Some people are being told, even after they have done this, oh, well, you don't qualify. Oh, I don't qualify, but I've been paying into it all my life. Well, so why can't I get the medical help I need? How many of us are going to have to die today? How many people are going to have to die today for them to understand they need to do the right thing? Thank you.
Thank you.
Yeah.
Thank you so much. One more speaker, actually, and then we'll come back to our lineup. But John Sidar, if you'd like to join us, cool.
Yay, John!
Thanks.
Hey there. Hi, everybody. I'm running for Congress in Virginia's 1st District, which starts down in Williamsburg, Jamestown, goes up the entire west coast of the Chesapeake Bay, all the way over to the Richmond area with New Kent and Hanover, and all the way up to Prince William County. And as I travel around this district, I get questions that I can't answer. I was talking to the watermen up in Kilmarnock. You know, the people who do the oyster fishing and the crabbing and the striper. They get up in the middle of the night when it's dark so they can cast their nets or pull up their pots at first break of day. They make too much for Medicaid, and their premiums went up 60% last year after Trump destabilized the insurance market. So they asked me, they said, John, we know Congress has already made Medicaid expansion possible. Why is Richmond against it? And I had to say 3 words a politician never likes to say. That is, I don't know. I don't know why they think it's okay for a healthcare CEO to make $30 million a year and still be against a $15 minimum wage. But I do know this. With your energy, your passion, and your tenacity, you will get this done. You guys inspire me. Thanks so much for doing this for everybody.
Again, 100% the real heroes today are the people who have never stopped fighting, and we're so grateful to them. Miss Charlene Bright, a face that I've seen out here fighting so often. I'm so grateful. Thank you for being here today.
Okay.
Woo! Woo!
I'm glad to be here to represent and fight for Medicaid expansion.
Yes.
And I want to start my story back to when I first started struggling when I left the job market. And I was being told that they would not cover me. repeatedly. I'm struggling. I know something's going on in my body, but I'm trying to get coverage. But they're telling me that they can't cover me because I tell them I'm a diabetic with high blood pressure. No, you can't come in. I don't know if you know how humiliating that is for someone to tell you, and you know something's going on in your body, and you need insurance, but they're saying, because you're sick, we can't cover you. That's where my story began. But when he passed that legislation that they could not deny, it was like the Lord had just blessed me when I went in for my first exam and they told me about the cancer in my body. And I don't think I would be standing here today if it wasn't for some changes to the insurance system.
Yes.
And I know it's not over.
Yeah.
Because I'm still struggling to pay the premiums. You know, I have to work 3 jobs to keep it up, using my husband's income just to keep up. But the other thing I wanted to share, I left my daughter at home. She's 47 years old. She's been struggling with this abscess in her mouth. And I'm like worried, man, if that infection shoots to your brain or whatever, but we got to get you out of here to get you some help. And it's sad that people out there going through these things and they can't get into. I've gone through the process of trying to get an appointment. No, if you don't have insurance, we can't see you. That is unthinkable in America, where, you know, we got so much and we're going all aboard to take care of everybody else. We can't take care of our own. I mean, I'm a giving person, and if I know my daughter needs help, I'm going to do everything I can to find the money to help her out. But Medicaid expansion, if they continue these changes, people like that, they can get help. And I'm just glad to be alive to talk about it.
It's such an honor. I can't even say it to constantly fight along with people like you who are dealing with so much. Thank you for being here. We're fighting with you.
Yeah.
I really am always inspired by these actions. These are folks who need it the most, and I'm happy that all of us are standing up with them today, and I want to count on our legislators to do the right thing. I really believe that they can do it today. Okay, we're gonna introduce one more person, and then we're gonna close out after that. But Kenny, would you like to say a few words with us?
Yeah. Sure.
Yeah. Thank you so much.
Woo, Kenny! Yay!
Thank you so much, everyone, for coming out. There are literally lives on the line today. Lives on the line yesterday, tomorrow, you know, so on and so forth. Healthcare is a really big deal to everyone, but for me, it's a very personal thing. I had a mother who I lost 2 years ago to.
Louder.
I had a mother who I lost 2 years ago, who I lost to substance abuse and chronic homelessness. And we did not discover until she was 60 that she was also bipolar. And part of the reason why we didn't know that is because for decades of her life, she did not have access to quality health care. For decades of her life, she was going in and out of emergency clinics and things like that instead of having the proper care to go to see a stable doctor who could figure out what was wrong with her. My mom was only 62 years old when she passed away. That is way too young for someone to die, especially when it comes to things that are easily curable and easily accessible to take care of. So when we have people in that building saying that we don't have the money to save people's lives, that's crap. We have people in that building that are saying that it's partisan talking points, or that there's no money and that the money's going to go away from the federal government. You can't create a self-fulfilling prophecy on the federal level and then abdicate blame on the state level. That's crap. When people in that building say that, you know, we're going to get left with the bag if something different were to happen with the laws, I'm sorry, but when it comes to life, health and life, we promise life, liberty, and pursuit of happiness in this country. Why are we going to leave life out of it when people's lives are on the line? We can come up with the money for all sorts of things. We come up with money for tax breaks for corporations. We come up with tax breaks for rich people. We come up with all these other ways to pay for wars, all these things that take life. But when it comes to saving lives for the people that matter to us most, suddenly there's no money. So it's ridiculous to me. So at the end of the day, what we need to tell them in there, especially today, is that they need to start putting people over profits, their constituents over corporations, and frankly, healthcare over hyper-partisan talking points. Because that's the only way we can be a change maker. That's how we save lives, and that's how we move forward as a Commonwealth. Thank you very much.
Thank you so much. Again, everyone here today is sharing very personal stories, and we appreciate how hard y'all are fighting. We have people who are, their families are affected, they're affected. So thank you for sharing that, Kenny. That's really powerful and important. Today we're gonna close out with David Broder. Woo! Thank you so much for being here today.
Thanks for having me.
Woo!
So good afternoon, sisters and brothers.
Yay!
You know how I know we're going to win Medicaid expansion?
How?
Because this morning it was raining.
Yeah.
But somehow when we all gathered here, the clouds parted, it stopped raining, sun is shining on the General Assembly. I hope they take note. It's a pretty good day to pass Medicaid expansion. I just wanted to say thank you to everyone for being here. If we could get one more round of applause for everyone like Charlene who shared their story. And who reminded us what's really at stake today. We've been fighting this fight for 6 years. We've actually been fighting this fight for universal health care for a lot longer than that. But we are so close to a major victory. I think about these past 6 years. I think about how in these last 6 years, my wife and I brought 2 amazing little girls into this world. I think about how in these past 6 years, my wife got breast cancer and beat it. Thanks to healthcare. And I think about how in these same 6 years, we lost my mother-in-law to breast cancer, simply because she didn't have healthcare. Because though she worked her entire life, she lived in Virginia. And so she wasn't covered. And so we're here today so close, here to bring home this victory that would have saved her life, but that could save countless more. And there's no need to talk anymore. We've had enough time for words. Now is the time for action. Now is the time for doing. Now is the time to vote yes on Medicaid expansion, so no one else has to go through the pain of losing a mother or a grandmother, a husband, a wife, a child. So now is the time for action. We are going to go from here. We are going to wrap up this event, but our work is not over. We are going to march to the Bank Street entrance so that we can meet every single legislator, so that we can meet every legislator who's coming to the Capitol today, to remind them what this is about, that no Virginian, that no person should die for lack of health care in the wealthiest country in the world. Who's with me? Who's going to march down to Bank Street with us? And who's going to win Medicaid expansion? Thank you so much for being here. We are not going to stop until we get this done. Thank you.
Get over there so we can have a picture with all these bodies in one place. Come on, move! Yes, we can! 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 Yes, we can!
What do we want?
Medicaid expansion!
When do we want it?
Now!
What do we want?
Medicaid expansion!
When do we want it?
Now!
What do we want?
Medicaid expansion!
When do we want it?
Now!
Today!
Today! Today! Do your job! Do your job! Tommy Norman, do your job! Tommy Norman, do your job! Tommy Norman, do your job!
Yep.